Your throat feels sore, your voice sounds different. Could it be something more serious? Throat cancer isn't as common as other cancers, but it's still diagnosed in over 12,000 people every year in the US alone. And the scary part is that many of the early signs are easy to overlook. And by the time symptoms become obvious, the cancer may already be advanced. So in this video, we'll break down the 10 warning signs of throat cancer you shouldn't ignore. Catching it early can make all the difference. So let's get started. Kicking off our countdown at number 10 is persistent sore throat. We all experience sore throats from time to time, often due to colds or minor infections. But if a sore throat sticks around for more than 2 weeks without improving, it could be a red flag. A persistent sore throat that doesn't respond to medication or home remedies might be caused by something more serious, like a tumor pressing on the throat tissue. Take Jose's story, for example. In 2005, he noticed a sore throat and ongoing hoarseness. At first, he assumed it was nothing serious, but when it didn't go away, he got it checked out. It turned out to be early-stage laryngeal cancer. Thanks to early detection, Jose was able to receive treatment and recover. Similarly, Steve experienced a sore throat that lingered for weeks and eventually discovered he had a tumor at the base of his tongue. Early detection saved his life. If you find yourself constantly reaching for throat lozenges and nothing seems to help, that's your body telling you something isn't right. It's worth getting checked out by a doctor. Better safe than sorry. Next on our countdown at number 9, hoarseness or voice changes. If your voice suddenly sounds different, deeper, raspier, or strained, and it sticks around for more than 2 weeks, it might be more than just a sore throat or overuse. Throat cancer can affect the vocal cords, causing noticeable changes in how you sound. When a tumor presses against the vocal cords or nearby tissues, it can make your voice sound hoarse or strained. And it's not just about the sound. It can also make talking feel uncomfortable or even painful. According to the American Cancer Society, persistent hoarseness is one of the earliest warning signs of laryngeal voice box cancer. If you notice that your voice isn't returning to normal or keeps getting worse, it's time to take it seriously and get it checked out. Voice changes can happen for lots of reasons: colds, allergies, or talking too much, but if it lasts longer than a couple of weeks, it's worth asking your doctor about it. Early detection could make all the difference. Next on our list at number 8, difficulty swallowing, dysphagia. Having trouble swallowing food or even liquids could be more than just a sore throat. It might be a sign that something is physically blocking your throat, like a tumor. Throat cancer can cause dysphagia, difficulty swallowing, making it feel like food is getting stuck or going down slowly. It can also cause pain while swallowing or even lead to choking. When throat cancer develops, it can narrow the esophagus or create pressure on the muscles used for swallowing, which is why food may feel like it's getting stuck. According to the American Cancer Society, difficulty swallowing is one of the more common early signs of throat cancer. If swallowing has become uncomfortable or painful, especially if you're also losing weight because eating has become difficult, it's time to talk to your doctor. Next on our list is a lump or swelling in the neck. A painless lump or swelling in your neck could be an enlarged lymph node, which might mean your body is fighting off cancer cells. Lymph nodes naturally swell during infections, but if the swelling lasts for more than 2 weeks or keeps getting bigger, it's worth investigating. Take Emily's story, for example. She noticed a small, painless lump on the side of her neck. At first, she thought it was just a swollen gland from a mild infection, but when it didn't go away after a few weeks, she decided to get it checked out. Doctors discovered that Emily had early-stage throat cancer. Because she caught it early, her treatment was successful, and she's now cancer-free. According to the American Academy of Family Physicians, malignancies are found in about 1.1% of patients who visit their doctor with unexplained swollen lymph nodes, and the risk increases with age. Number 6, ear pain without an infection. Throat cancer can sometimes press on the nerves connected to your ear, causing ear pain that just won't go away, even when there's no sign of an ear infection. It might feel like a dull ache, a sharp pain, or even a constant pressure deep inside your ear that lingers no matter what you try. Some people mistake it for an ear infection and try eardrops or painkillers, but nothing helps because the problem isn't in the ear. It's in the throat. When a tumor presses on the nerves near the throat, it can trigger pain signals that radiate to the ear. If the pain lasts for more than 2 weeks or keeps coming back, especially if you've ruled out an ear infection, it's worth getting it checked out. We're halfway through the countdown. If you're finding this helpful, don't forget to like and subscribe. It really helps the channel and lets us keep making content like this. At number 5, unexplained weight loss. Sudden weight loss without trying could be more than just a fast metabolism. It can be a sign of several types of cancer, including throat cancer. If you've lost more than 10 pounds in a month without changing your diet or exercise routine, it might be because your body is burning extra energy trying to fight off cancer cells. Cancer cells grow quickly and require a lot of energy, which can cause your body to break down muscle and fat even if you're eating normally. Throat cancer can also make eating difficult if it causes swallowing problems or reduces your appetite, which adds to the weight loss. Losing a few pounds here and there is normal, but when the weight keeps dropping without any effort, especially when combined with other symptoms like difficulty swallowing or a sore throat, it's time to get it checked out. Your body could be trying to tell you something. Next on our list at number 4 is persistent cough, especially with blood. A cough that sticks around for more than 3 weeks, especially if you're coughing up blood or rusty-colored phlegm, could be more than just a lingering cold. When cancer develops in the throat, it can irritate the tissues and cause tiny blood vessels to rupture, which leads to bloody mucus. A dry, nagging cough that just won't go away is bad enough. But when blood shows up, that's a definite warning sign. It's easy to brush it off as nothing serious, but if you've been coughing up blood or dealing with a stubborn cough that won't let up, it's time to get it checked out. Better to know for sure than to ignore it. Moving on to our countdown at number 3, we have trouble breathing or noisy breathing. If you've noticed wheezing, a whistling sound when you breathe, or you're struggling to catch your breath, it could be more than just seasonal allergies. A tumor in the throat can press on your airway, making it harder for air to pass through and causing that tight, strained feeling when you breathe. Shortness of breath or noisy breathing that isn't tied to asthma or a respiratory infection shouldn't be ignored. If breathing feels harder than usual or you're constantly wheezing, even when you're at rest, it's time to see a doctor. Catching it early could make a big difference. We're almost at the top of our list at number 2, persistent bad breath. If you've got bad breath that just won't go away, no matter how much you brush, rinse, or pop mints, it could be a sign of something more serious. Cancer cells in the throat can break down tissue, causing a foul smell that lingers. If the bad breath comes with other symptoms like a sore throat or trouble swallowing, it's not something to ignore. A quick checkup could give you peace of mind, or catch something early before it gets worse. At the top of the list is a sore or ulcer in your throat that just won't heal. It might look like a patch of irritated tissue, an open wound, or even a spot that bleeds easily when you eat or talk. Non-healing sores are one of the most common early signs of throat cancer. This happens because cancerous cells interfere with the body's natural healing process, making it difficult for the tissue to repair itself. According to the American Cancer Society, persistent sores in the mouth or throat that don't heal within 2 weeks should be evaluated by a doctor. If you've had a sore in your throat that isn't getting better or seems to be getting worse, don't wait. Catching it early increases the chances of successful treatment and could make all the difference. And there you have it, 10 signs and symptoms of throat cancer. Not every sore throat or cough is a sign of cancer. Sometimes it's just an infection or acid reflux. But if any of these symptoms last longer than 2 to 3 weeks or keep getting worse, it's worth getting checked out. Early detection can make a huge difference when it comes to treatment and recovery. If you've noticed any of these signs, especially if you have more than one at the same time, don't wait. Schedule an appointment with an ear, nose, and throat specialist, ENT, or your regular doctor. A quick checkup could give you peace of mind or catch something early before it becomes serious. Throat cancer can be aggressive, but the earlier you catch it, the better your chances of successful treatment. Ignoring symptoms won't make them go away, so listen to your body. If you found this video helpful, hit that like button and subscribe for more health tips. Have you or someone you know experienced any of these symptoms? Drop a comment below. We'd love to hear your thoughts. And if you want to support the channel, check out our merch or hit the super thanks button. Every bit helps us keep creating awesome content. Thanks for watching and have a healthy and happy day.